Hello everyone, here I am your EG Nursing Guide. In this video, we will discuss drug dose and drip calculation. Let's begin the video. Before going to the formula or method, we should learn the metric table, which will make us easier to calculate dose or drip. Now let's discuss the metric table. 1000 mcg equals to 1 mg. 1000 gram equals to 1 kg. 1 kg equals to 2.2 lbs. 1000 mg equals to 1 gram. 1000 ml equals to 1 liter. 1 ml equals to 1 cc. 5 ml equals to 1 teaspoon. 3 teaspoon equals to 1 tablespoon. 15 ml equals to 1 tablespoon. 30 ml equals to 1 ounce. 1 ounce equals to 2 tablespoons. Hope you all have understood metric table, which is also very necessary. Now let's discuss the formula of dose calculation. Dose equals to the desired dose prescribed by the doctor, or the prescribed dose which we want by the dose we have on the hand, or available dose, into volume. Now, the desired dose is the dose that is prescribed by the doctor to be administered to the client, whereas the available dose is the total amount of the drug that is available, which is the volume is the total amount of the fluid within the available drug. Now, we can take the example of ceftriaxone. We want the ceftriaxone of 250 mg. We have the ceftriaxone of 500 mg, which is our available dose. And this 500 mg ceftriaxone is to be dissolved in 10 ml, which is volume or dissolved amount. So want is 250 mg. We have is 500 mg, and the amount to be dissolved, or the volume, is 10 ml. I hope you have understood. Now let's discuss about the IV drip calculation. It is our responsibility to infuse the fluid at the prescribed rate. We can infuse the IV fluid either by IV seat or infusion pump. There are two types of IV tube that deliver: microtube and macrotube. Macrotube deliver 10 to 20 GTTS or drop per ml, whereas microtube deliver 60 GTTS or drip per minute. Now let's discuss about the IV drip rate, GTT per minute. The formula to calculate the IV drip rate or GTT per minute is the volume in ml by time in minute into drop factor, GTT per ml. The GTT is also called as a drop. Drop factor is number of the drop in 1 milliliter of the solution. GTT also called as drop. Now let's discuss about ml per liter. This is the formula of calculating ml to be delivered in an hour. The amount of the solution in ml by time in hour. Now we will discuss about the dose, drip and ml per liter calculation further with the example. First, let's discuss the few examples of dose calculation. Doctor prescribed meropenem of 500 mg IV TDS. The available dose is 1000 mg per 10 ml. Calculate the volume required for the injection. The desired dose of meropenem is 500 mg. The available dose is 1000 mg. The dissolved amount is 10 ml. Now, according to the formula, the desired dose is 500 mg. So now the available dose is 1000 mg. The volume is 10 ml. 10 ml equals to 5 ml. So the volume required for the injection is volume required for injection is 5 ml. Hope you have understood. Doctor prescribed medication of 1.5 gram per oral OD. The available dose of medicine is 500 mg per tablet. How many tablet will you administer per dose? So we have to find here the tablet we will administer per dose. So the ordered medicine is 1.5 gram per oral OD, 1 dose. The available medicine is 500 mg per tablet. So the tablet to be administered is what we are going to find. Now using a dimensional analysis. The prescribed medicine is 1.5 gram per dose. Here we have to be careful. What we have ordered is in gram and what available is in mg. So now here we need to know the metric table which we have already discussed. We need to multiply time conversion factor. So 1 gram equals to 1000 mg. We have already known this from metric table. Now let's multiply with our available drug, which is 1 tab equals to 500 mg, as it is already mentioned in the question. Now this gram and this gram is cancelled with each other, and this mg and this mg is cancelled. So we have here two zeros, and the two zeros of 1000 is cancelled with each other. So after this problem is solved, the answer will be 3 tab. 3 tab is the dose to be administered. This is we have solved this as per the dimensional analysis. Now let's solve the same as per our formula. Desired dose by available dose into volume. The desired dose is 1.5 gram. The available dose is 500 mg and the volume is 1 tab. So already according to the metric table, we should always remember 1 gram equals to 1000 mg. So 1.5 gram equals to 1500 mg by 500 into 1, which is 3 tab. I hope you have understood this. Let's calculate the drip now. Doctor ordered Ariel 2000 ml over 24 hours. The drip factor for IV tubing is 15 GTT per ml. How many drops per minute will you administer? The ordered is 2000 ml over 24 hours. Now we have the formula of drop per minute, which is volume by time into drop factor. Now here we are going to use the dimensional analysis. We have 2000 ml RL, which is to be given over 24 hours. Remember the drift factor. 1 ml equals to 15 GTT. Here the drift factor is 15 GTT per ml. 1 ml equals to 15 GTT. So this 24 hour has to be converted to the minute. So 1 hour equals to 60 minutes. Now here we cancel out the ml and we also cancel out the hour. So here we will multiply everything of the top and everything of the bottom. 15 into 2000 into 1 by 1 into 24 into 60. 15 into 2000 into 1 equals to 30,000 and 1 into 24 into 60 equals to 1440. So the answer will be 20.84. Round up, so the administered drop per minute will be 21 GTT per minute. Hope you have understood this.